Hello, my name is Herbert Parsi. I am a certified alcohol and drug counselor. Aspirations of being a licensed drug and alcohol counselor, and also a supervisor. I also hold credentials in criminal justice as a criminal justice counselor. My background, majority of my career was spent inside of the prisons counseling inmates with substance use disorder. Um, the National Institution of Drug Abuse clearly states that 65%, and maybe over 65%, and maybe over of all prisoners are diagnosed with substance use disorder. The CDC clearly states the majority of adults with substance use disorder were adolescents with substance use disorder. So this here raises a red flag to say that, hey, if substance use disorder is treated appropriately and addressed in its appropriate fashion during adolescence, that, hey, it may be a chance to lower the crime rate and actually lower the loved ones that we have that are behind bars. Okay, so with this project, I did some research to a few of the local facilities. I actually scanned the area and talked to a couple of facilities that actually focus on adolescent treatment for substance use disorders. Those particular programs actually geared towards adolescents with substance use disorders that may have some defiant behavior at the home, in school, so on and so forth. They're pretty much treating adolescents with less behavior issues that are able, the eligibility, they have to be able to function within a social setting. The majority of the facilities that I interviewed, they have to be able to socialize appropriately in a social setting with youth. A lot of the youth that I've come in contact with, and a lot of adults, of course, were unable. It didn't display the ability to function appropriately in that setting, which actually raised a red flag with me with that. All right. So my aspirations is to build a facility to actually house and treat these particular adolescents with criminal backgrounds, behavioral issues, and things of that nature. Be able to house them and treat them from an inpatient and outpatient stance. We'll have different levels of care, of course. We'll treat co-occurring disorders. We'll do anger management. We'll bring the family in. And now this actually brings up the point of me bringing the family in. Multi-dimensional family therapy will be the primary, well, also along with person-centered treatment, will also be the primary approach within my facility. I would like to build this facility, bringing in the family members and dealing one-on-one with them and their perspective of the child, the adolescent, to appropriately address the family dynamic in efforts to strengthen and bring more support to the youth. With the support of the youth, it actually raises the potential of that youth actually recovering and having a sound recovery. With this particular approach, we will also use motivational interviewing. We will use cognitive behavioral therapy, and children respond well with cognitive behavioral therapy, and they love to be challenged to think. Children usually don't feel that they have a voice. They are less likely to express themselves, especially if they are bonded to criminal lifestyle. That actually goes along with drugs and things of that nature. So basically, I would like to put together this program to bring the community together and efforts to lower the crime. So the community actually starts in the household. The community is the the unit that nurtures the child, that actually puts things together to increase or decrease the chances of this child actually being exposed or not to drugs and alcohol. Now, with that being said, this is how my program is going to help with lowering the crime rate. So, in the programs, of course, I do expect to have some sort of difficulty, especially dealing with youth with troubled backgrounds and things of that nature. There may be fights, there may be outbursts, there may be vandalism and things of that nature. How I would deal with these things is from a one-on-one stance, knowing or assessing the child, a youth, to be appropriate for a social setting or inappropriate for a social setting starts in the one-on-one counseling. I will not shun any youth with behavioral issues. We will tackle those behavioral issues preemptively. We will deal with them on a one-on-one basis and actually walk them into the steps and actually nurture them into that that social environment to where it could be more supportive. Okay. Dealing with the family circle. A lot of families aren't educated on what substance use disorder is, how it's developed. A lot of family are in denial and things of that nature. There has to be a family approach, and this is where the multidimensional approach comes in. Multidimensional approach is known to nurture this particular demographic that I challenge myself to service. What we would do is bring the family in, deal with their individual perspectives, issues, and concerns, and build or nurture and build a more social setting for them within the household and within treatment. Build on communication skills, how to be of more support of the person with substance use disorder, which is the child, how to understand their particular perspectives and needs, and how not to project our perspectives on them, so that they can be of more support to the youth. Okay, with that being said, my dreams and aspirations is basically to lower crime. I believe that building a structure dedicated to the youth will decrease their chances of continuing their substance use and being adults with substance use disorder and being a part of the 65% of men incarcerated with substance use disorder. Thank you for hearing me out.